Okay, so, wow, following those three folks is going to be a challenging one. First, I want to say thank you to Sarah and to Steve and the rest of the CHEE staff. This conference, Health, Environment, and Energy, is something that for me is actually personal, and let me tell you why. My history in this field began in 1990 when I decided, because I cared so much about the environment at that point in my life. I was 30 years old, coming off of the military, trying to decide, what do I want to do? I've got a family, I don't want to be out at sea all the time. What do I want to do with my life? And I knew that it had to be purposeful, and I knew that we had these mounting environmental problems back in 1990. And I found this Scientific American magazine. The cover was energy. Somebody has read that magazine. There was Energy and the Environment, and with a picture of the globe of the world, the globe on the front. And I read that thing cover to cover, and I decided that I've got to do something about this energy problem because I care so much about our Earth and the environment, and that I need to do it in a way that I can be comfortable. I can be comfortable with my own talents and bring that. And I was, kind of geeky, a little bit of an engineer type, so I decided to go do some engineering. And I knew that I wouldn't be able to solve this entire energy environment thing by myself. So I picked a niche in the energy space, and it was buildings, because I thought buildings were really cool, but I didn't want to be an architect. So I studied architectural engineering and learned a lot about energy and buildings. And that launched me on this career, and I had no idea where it was going to take me. The last place in the world I thought it might take me is to actually learn about and care about epidemiology and health issues. What I've discovered is that these three things are so intimately linked that you just can't separate them. We always do, and we're guilty of that, but we cannot separate these three. Why do people not want a dirty, unhealthy environment? Because it affects us and it affects our health. In fact, I remember Gina McCarthy, who eventually became the administrator of the EPA, but I knew her before then. And I remember the first time that I saw her, she said, "I'm not a tree hugger, I'm a people hugger. I care about the health of people in buildings and in outside air. And if we don't have clean environment both inside and outside, then people won't be healthy." So those three things are really linked at the hip. Felicia in particular, I want to say that I have an answer to your question. Does energy efficiency improve health or not? And the answer is, and this is my favorite answer to questions, and it irritates the heck out of everybody who knows me, it depends. It depends on what you do in the building, it depends on your body and how susceptible you are to all these things, and you alluded to all that. But it depends is really important here, because a lot of what it depends on are things that we can control. Now, I as an engineer or a program researcher or anybody, I can't control the behavior of all the people who live in buildings, but I certainly can control what we do to our buildings in order to make them less likely to cause health problems. So a lot of what we're talking about is selective risk management approaches in the design, operation of our buildings, maintenance of them, etc. And those things, none of them are simple. So, and of the 118 million dwellings that people live in this country, they're all different. They're all unique. Even if they start out looking like carbon copies, once people move in and start changing them, they're all different. And so there is no one answer to your question, Felicia. It will end up being a risk assessment of how likely is it that we're going to have problems in buildings. So the rest of my career that led me to this realization that health and environment and energy are all intimately connected. I started in the early 90s to help to launch the Energy Star Homes program, because energy in buildings, remember I said that's why I got into this in the first place. And after about 5 years of doing that, I became really intimately aware of how little most consumers cared about energy efficiency because their bills weren't very high, so it didn't really affect them. And there's nothing we could do or say that would make them care about it. And we weren't even talking to the consumers directly, we were talking to the builders. We're trying to get the builders to do better, and they said, we can't sell this stuff because people don't care about energy. So what do people care about? Well, a lot of them care about health, and so we started to figure out how can we make sure that the energy efficiency improvements in buildings lead to healthier buildings. And that's when the journey started, is in the mid to late 90s when it started, for me anyway, when I started asking these questions. By the early 2000s, I was convinced that we needed some kind of a complementary label to the Energy Star label program that would tell people that they have a less risk of health problems and higher probability of having a healthier house. So I took the opportunity in 2004 to jump over to the EPA and launch the Indoor Air Plus program, and that was a complimentary label. It took us 5 years to get through all the back and forth, et cetera, but we did launch it in 2009, and I'm really happy to say that we have almost 20,000 Indoor Air Plus qualified homes since I launched the program in 2009. Going strong, they're developing standards for existing homes as well. And there's a whole bunch of other programs that have been happening since then. Zero Energy Ready Homes is a DOE program right now that I'm intimately involved in that actually requires both the Energy Star and the Indoor Air Plus. The Indoor Air Plus at EPA are developing existing home specifications. There's a couple other programs that I'm pretty excited about that are going even further. The weatherization program has been working in healthy home protections for their clients for over 30 years. But the state of Washington one-upped that by developing a weatherization plus health program that actually merges the two. My friend Ellen Tone, who is probably in the audience somewhere, started this program called One Touch, which is, there's Ellen over there. Very exciting to me because you don't have to actually marry the two programs, a health-related program or a housing-related program and an energy, but you can at least talk, and that's a structure where people talk between the programs. So that's all very exciting. I have only 3 minutes left, so I want to make sure that I tell you a couple of highlights of where we are, progress that we've made. And I'm just going to rattle them off. So we've made big reductions in pollutant emissions inside sources, smoking bans, lower formaldehyde, reductions in VOCs in chemicals that are used in household and office cleaners. Those things have all been good. We've reduced some of the emission sources that we have in buildings. We've had significant decreases in outdoor air pollution, and that affects indoor air, because what's our solution? What's the only solution that most people think of when it comes to indoor air pollution is outdoor air ventilation. Well, if that outdoor air is not healthy, then what? Well, then we filter. That's a third thing. We've made some advances in filtration. Changes in construction practices, a lot of the stuff about that Felicia mentioned, about air tightening, adding systems that do a better job of moving air, controlling pollutants. We've made a ton of progress there, and I don't have time for any of those details. And increased awareness of indoor air quality. You all being here to talk about these issues, the growth of the programs, I have the pleasure of knowing some of the builders who are actively promoting indoor air quality and health issues as a result of their offerings, and some of them are doing 1,000 homes a year or more that they're doing to the Indoor Air Plus program specifications. So that's very exciting to see that increased interest, and it's only happening because they can sell it. Remaining challenges, event-driven hazards have increased, such as the fires in California. That's an issue that I think is going to become increasingly important, especially in the public eye. Managing moisture while ventilating in hot, humid weather. That is, ventilation has been something that I think we've by and large convinced most people is a good thing, except those people in southeast climates where if you ventilate without knowing how to control humidity in your inside, then you get mold, and that is not good indoor air quality. So that continues to be a challenge. Smarter ventilation systems, taking advantage of the Internet of Things and smart technologies. There's a lot of opportunities there, but a lot of challenges. Compartmentalization of attached dwellings is another big challenge, kind of difficult. And then some new hazards like flame retardants and air fresheners and things like that we don't know enough about how bad they are in terms of health impacts, but we do know, we do have some, some science that suggests that they are problems. And then finally, a few highlights of research that we're doing at the Department of Energy Building America program that I hope will be leverageable into a bunch of new opportunities. We're doing, most important I think, we're doing a new home indoor air quality baseline study. Now this does not attempt, nor should it, to address any of the health questions that you asked Felicia. But if we better understand in 5 different climates around the country what the pollutants are in normal homes that are being built to the newest energy codes, and under what, with a fair amount of detail, under what configuration is causing the pollutants, then we can be much more informed about our standards, our guidance that we provide, and which research questions related to health that we need to ask. So we've got a fair amount of coordination that you and I are going to have to do for this year. Smarter ventilation systems, we've got a bunch of new technologies that are starting to hit the streets, a bunch of that have been conceived but don't exist yet because manufacturers haven't found a market for them, so we've got a bunch of challenges there. We're working on that at Building America. We've got a project to develop a smart kitchen range hood that turns on automatically, it's energy efficient, it has high capture efficiency, and it has a modest price point. That's something that doesn't exist in the marketplace right now, although it's going to exist soon. And finally, we're doing some work to validate indoor air quality sensors that could be used to do smarter ventilation. That's all I think I have time for, although you can tell since I rattled off many of my main points in really fast that I got a lot more that I could say as the rest of my fellow panelists. So this has been quite a pleasure to